The prevalence also probably has increased due to so many things in our modern world that are not encouraging healthy collagen. I think that many people are ticking time bombs. You have to be able to get out of the hinge position. That may be the most important thing that we cover today, is just the fact that the individual has to be ready to fully take their mind into healing.
Today I'm going to be interviewing Dr. Brian Hutcheson. Dr. Brian is a chiropractor in Fort Myers, Florida that specializes in upper cervical instability. And I was actually treated by Dr. Brian last year for neck curve correction and saw a lot of positive results from that, and just thank the world of Dr. Brian. So I'm really grateful that he is joining me today on my channel. We're going to be discussing cervical instability, what his treatments look like, what are some things that you can do from home, and just kind of go over some questions that you guys had for Dr. Brian. So I hope you enjoy. I will link Dr. Brian's YouTube channel and website down below, and make sure you subscribe. Thanks so much for joining me, Dr. Brian. I'm really looking forward to our conversation about neck curve correction and cervical instability. And before we just jump into that, could you give me a little bit of background about you and why you became a chiropractor and what led you to specializing in cervical instability?
Yes, Rachel, thank you so much for speaking with me today. And I'm just really happy to see you and how well that you're doing. And I became a chiropractor. I was actually studying business and I wanted to go into sales and do what my father did. And halfway through undergraduate, I just had a change of heart. My brother had terrible scoliosis his whole life and ended up needing Harrington rods, which is where they fuse almost your entire spine. I think he's fused from maybe C7 or T1 down to his lumbar spine. So it was a very, very, very severe operation. And that just kind of put it on my heart, that I always had a, compassion for people who go through debilitating skeletal issues, and saw the need for co-management, where surgery saved his life because it was a 90-degree curve and it was going to completely compress his heart and his vital organs. And, he needed it to survive, but also that when he went to chiropractors or got different things done, he always left with a smile on his face, and it seemed to help his neurology and him think more clearly. So that's really where I got my purpose, or, my desire to become a chiropractor.
Wow, that's amazing. And what do you think led you to specializing in cervical instability? Because I know that seems to be kind of a focus for you, just judging based off of your website and your YouTube channel.
Yeah, it kind of was on my part by accident, but I think as far as what I'm supposed to be doing, I think it was by design, because given my brother having had these difficult, challenging injuries, I always wanted to find out about the people that no one really knew what was wrong, because his scoliosis was progressing as he grew and the doctors had no clue. They're like, we have no clue. They tried bracing. He was debilitating in pain when he was in braces. The curve just kept getting worse. And ultimately he needed that surgery, but I couldn't help but think, couldn't there have been something we could have figured out that could have stopped that curve from progressing? So, after I became a chiropractor, I just found maybe 10% of people that I treated, I couldn't make big changes with. I would do everything, send them to different practitioners, and they would feel good when they left the office, but an hour later, a day later, everything would come back. And I got led down that rabbit hole toward what was a missing link. One of my colleagues, Rachel, had a digital motion x-ray back the year that I graduated in 2013. And it was very intriguing. And I ended up calling everyone in the country that had anything written about it online, and, prayed about it really hard for 6 months, and ended up purchasing one after only having been in practice for like 2 years or less. So that's what led me down the path to discovering a lot of these instability injuries, and then to coming up with plans of, well, what can we do with that? Because they don't go into very much depth about instability. And in most schools, I don't think in chiropractic school and medical school, we go over it, but there wasn't really clarity on how to treat them. So that's what I've been trying to help people with.
That's incredible, and it's much appreciated and much needed. I would love if you could just, for anyone that may not know, if you could just describe briefly what cervical instability is and maybe what you think causes it?
Yeah, sure. So cervical instability is when the bones are not working together. Like, for example, you may initiate a motion where you jut your chin forward, and then your skull may move more than what the normal physiological motion is. Or if you turn your head, your first bone in your neck may shift off the second bone further than it normally physically is supposed to. And when that happens, Rachel, the not so much is just the bone shifting off a little bit the problem, but it's more so the reaction of what that means for your nerves, for your blood vessels, for everything that is connected to those bones, from your tendons, your ligaments, and how they start to signal nociceptive input pain, and then abnormal function. Because when the bones are in the correct alignment and have good curvature, then and they're stable, they're going to function correctly. So you're going to have a normal range of motion without pain. You're going to be able to move and tolerate the force. So when you have instability, it means that all of that falls to the wayside. You could basically do something very simple and feel just absolutely terrible. And probably people that follow you and subscribe to your message are pretty versed on the wide array of different symptoms that you can get. Cervical instability can be very obvious on imaging. Sometimes you could just get a regular x-ray and you can see that a bone is completely dislocated over another one, and then it would potentially warrant a emergency surgery for fusion. Those are the ones that practitioners have known about for a long time, like after a traumatic motor vehicle accident or a gymnastics injury or something, fall doing some extreme sports. But the interesting part is that there's actually much smaller, but still very neurologically significant forms of cervical instability. And that's why we use things like digital motion x-ray, or on occasion an upright MRI with flexion and extension, because some of these forms of instability are only visible when you really watch the bones as they move, and then pause the video right where you see the bones shifting off each other. Because otherwise, 20, 30 years ago, many people probably did have subtle instability, but it wasn't known what was wrong.
Okay. And what do you think the significance of, say, for example, somebody has really severe instability on imaging but has no symptoms, or if somebody has very mild but very severe symptoms?
That is a great question. And if I could give you an answer that would really be clear to everybody in the world, I mean, I'd probably have that's like the $1 million answer, right? But some of my suspicions are some people, their anatomy, their physiology in other places is very, very strong. So let's say they just have a really great connective tissue through the rest of their body, but for one reason or another, they have 5 or 6 millimeters of instability at C1, C2, and they feel fine. Like, for example, I think I still have almost 5 millimeters on the left and 3 on the right, but I've rehabilitated, my body to where, I feel, really well overall. And then I have seen a couple of individuals also that are symptom free that have significant instability. And then other people, their collagen overall in their whole body may not really be as durable or as strong. They're generally also having potentially anomalies in the blood vessels or the nerves or the spinal cord. It could be just a little bit less flexible or bendable. Some people can undergo like a lot of pressure on their spinal cord where you can see on an MRI, wow, like you really should have pain here. And they're like, no, there's nothing, like there's no problems there. And then other people, it's just barely like a little disc bulge. And they're like, oh, I get this shooting pain down my leg. So we have to be careful to not take a diagnostic finding and then completely identify with it too quickly. Because first of all, I mean, miracles happen all the time. And then second of all, one measurement is usually not indicative of your whole entire presentation. And sometimes it is, right? There's like, oh, this disc is completely crushing your spinal cord right here. Or, this, you have, you know, 10 millimeters of instability to the left. I mean, your head is almost falling off your C1. But in cases that aren't that home run, there's a lot of a gray area.
That makes sense. It seems like cervical instability is becoming a lot more common. Does it seem like that to you? And if so, why do you think that is?
I think it's partially awareness. I think that there probably have been a lot of people that were bedridden, that were kind of kicked to the curb in society in the past, maybe 100 years ago, 50 years ago, 30 years ago, that, nobody knew they had an actual structural problem that was causing neurologic deficit. And I think that now, just with the internet and our interconnectivity, people getting easier access, there's probably a digital motion x-ray in almost every state in the US. The buzzwords of, cervical instability have really permeated through the web in the last handful of years. And so I think that people are becoming more aware of it. The prevalence also probably has increased due to so many things in our modern world that are not encouraging healthy collagen. I mean, from just the way we live, sedentary, probably doesn't help all of the electronics we're constantly exposed to. I mean, I don't think they help support our body to be stronger. And then, there's probably still more research to show what kind of side effects that they could have. Food is so modified from its original form nowadays. That definitely can't help us build good tissue. And then everyone's so anxious and nervous. But it seems like more people in society are just in this constant stress phase, and that breaks down your collagen as well. And then you could have some trivial injury, or you're constantly in this bad posture for 5 years. And I tell people a lot that, Rachel, I think that many people are ticking time bombs. So we have this incredible innate or God-given ability to heal from a lot of catastrophic injuries, but it still doesn't mean that we don't have to do our part. And so a lot of people are just walking around with a postural problem, some form of instability or other poor curvature. And it's just going to take just looking too fast one time, looking real quick for that to be the last straw. And then they're like, whoa, now I have this crazy sensation. Or I even had somebody tell me recently, they got a gentle upper cervical adjustment, like almost nothing, right? Barely set the atlas. And ever since then, they've had all of these neurologic symptoms. But it's because it was a straw that broke the camel's back. It's not that the force that the upper cervical chiropractor, I mean, he literally like, boop, went like that. I'm like, if you ever taken a step outside, you have more force go through your neck than that. But right, by lining that up and creating better mobility, all of a sudden there was this neurologic catastrophe because people are walking around like ticking time bombs with this stuff.
Absolutely. Yeah, I really loved everything you mentioned there, just including how our modern world has changed with cell phones, and the food we're eating is not very nourishing for the most part. And all those things affect every cell of our body. Like you said, it seems like for a lot of people, they get by and then they have that trigger where all of a sudden they become very, very sick. And it's just interesting how for most people that are chronically ill, there is that sort of like trigger where everything all of a sudden becomes worse.
Yeah. Before we go to the next topic, I think that that's a really important part. Sometimes that trigger is the big reason why that you get into the position you are. But I think that in my history of being a chiropractor for almost 11 years is that the people that stay so focused on that one thing where it all changed, I guess it's hard because that's where you felt the trauma. But could you comment at all on your experience with people in things like that? Like focusing more on like what little things can you start to do that make you a little bit better, and then seeing also like your history. Were you in a bad posture for 5 years before? Did you ever have any tension? Or I mean, do you kind of know where I'm going with that?
Yeah, absolutely. I definitely think it can be easy to try to figure out, what was that trigger and focus on that too much, when in my mind, it just doesn't really matter. Like, was it Lyme disease? Was it, I don't know, stress, another infection? Was it mold? Was it all these different things that could be that trigger? But does it really matter what the trigger was? I don't think that it really does. I think that trigger may be what sends us over the edge, but it doesn't matter so much to, I guess, identify that trigger. And for me, it's been really helpful just to focus on my body's innate ability to heal and all the things that I can do to help my body to heal, even if something isn't perfect structurally, even if something isn't ideal structurally. I do think our body has an amazing ability to adapt, and it has an amazing ability to heal, even given less than ideal structural circumstances.
Yes, I love that. I love how you said that. And I mean, just for example, we can talk about me, we can talk about you. We've both given each other permission to, talk about each other. But, like you said, I mean, you recently wrote me an email and I was like absolutely ecstatic because, you're rock climbing again. And when I first met you over a year and a half ago, we were talking about like slowly progressing you. We talked about it. We're like, let's slowly, don't worry about this. Okay, so you've got a fusion, but that's not going to inhibit you. You're going to get back to rock climbing. I remember talking with you and with Jake about it. And we were talking about, we are going to get you rock climbing again. You're just such an amazing example of keeping focused on that power of just like the innate ability to heal, and that you can overcome things, and not completely identifying with where you were, but identifying with where you're going. And, that's just been incredible to see, Rachel.
Well, thank you. I appreciate it. And
Yeah.
you're obviously a part of my healing journey. And I think, that having that healing mindset makes all the difference. And for me, when I started to take my healing kind of into my own hands and started to believe that I could recover, that was a turning point for me. And so, yes, curve correction and prolotherapy were really helpful for me and were a part of my healing. I stopped desperately relying on that perfect treatment or that perfect doctor to fix me and realized, hey, like the most important part is going to come from within. And
Amen.
yes, there are plenty of tools that we can use to help with that. There are doctors like you that are helping people heal and, I mean, are quite literally miracle workers. But obviously that innate ability to heal is important, and it's something I think like really can hold people back from recovery if they are just in that mindset of like, nothing's going to work for me.
Yeah.
Because unfortunately, if you don't think something is going to work, there's a good chance that it won't.
Yeah.
And just, I think signaling safety to your brain to get out of that chronic fight or flight state can be so powerful for healing too.
Yeah. I think that maybe, and I'm happy to keep talking about many more things, but that may be the most important thing that we cover today is just the fact that, Rachel, you're 100% right, that the individual has to be not only ready to heal, but ready to like fully take their mind into healing. And I haven't read all of the Bible, but I do pray. And Anthony, my coworker, has been telling me that there's something where you're supposed to already believe you've received it, before you even have. And it can be incredibly hard to do when you're suffering with a chronic illness. It really can. It's so hard to pull yourself out of the depths of that. But I have seen individuals that have been suffering that have found a way through just incredible strength and faith to not lose sight of where they're going. And they just keep envisioning themselves that they're healing, that they're healing, and they're healing. And you want to know what? If you feel like it's stupid, well, it's really not, because the worst thing that can happen is that you don't fully heal. But the best thing that can happen is that your mindset actually helps you get better.
When we start to believe that we can heal, I think that really does signal safety to your brain and kind of can get you out of that chronic stress response. And so it does. And I think it's a hard thing to explain to people because they're like, well, my illness is real. Like, it's a physical illness. It's a physical problem. How can I do something with my brain to change that? But our brains really do have a strong ability to help our bodies to heal. And our brains have to be in that state where healing can happen, like that parasympathetic state where healing can take place. And so I think that can make all the difference. And I'm guessing you may have seen that with patients, seeing a difference in how the mindset can sort of impact the results.
Yeah, I think it happens immediately and indefinitely with patients that have, very challenging illnesses. Almost every one of, my cases that I've shared that have been people that have gotten better really quick from very serious symptoms, like they showed up in my office and they're like, I'm here to get better. Like I am here to get better. And some of them had 20 years of symptoms, like, 20 years of living in this spot. And they were just like, I'm ready. And when you just show up and you've already decided you're 100% ready to heal, it's just so helpful. That's a big part, just to continue to be ready. And I mean, I have empathy because, I know a lot of people that have had long-term illnesses and they've tried 20 doctors and they keep getting their hopes up. And then they feel like, it's almost like a comparison to somebody that really falls in love in high school, and then they feel like they can never fall that far in love again, and it's like that comparison of getting let down and not wanting to give it your all again. But I mean, how would you encourage somebody to find that within them to really just commit, not to put your faith in another doctor, but to put your faith in something bigger than you, that you're going to continue to be guided the right way if you really deeply focus on it and not to give up?
That's a really good question. I would say some things that have been helpful for me have been kind of stepping back from chronic illness support groups online and just like as much as possible taking focus away from illness and starting to visualize yourself healthy and healing and redirecting any negative thought patterns. And I think another thing that can be really helpful is finding people that have recovered from something similar and just listening to recovery stories. Instead of going on Facebook and seeing all these tragedies, go listen to a recovery story, and that'll start working with the neural pathways in your brain will start to change and say, hey, this person healed. I think maybe I can too. Right away, you don't have to fully believe you can heal, because I think it takes time. But I think starting with a curiosity, that's what I like to tell people. Start with a curiosity. Just say, well, what if I could heal? What if I could?
Yeah.
What if it could be possible? And then from that, it can kind of progress into believing that you can heal. And then from that, knowing you can heal. That's like kind of how the progression was for me. It started with the curiosity versus just waking up and saying, yep, I'm going to heal. It takes time to have that shift.
Yeah, it's true. I really think so. Maybe we can talk again in the future, or even just both put our minds together on how we can really encourage people to stay in that state of mind, or to enter that state of mind for the first time, where they first believe that they really deserve to heal, where they know that healing is possible, and where they can become 100% committed to focus on healing, and what that means, and how it doesn't mean discounting the fact that you're currently sick, but it means just kind of what we're focusing on, which is trying to enter the new you with like almost like you're going to jump off a cliff and trust the process. Please don't jump, but you know what I mean, like where you're just going to give it that blind faith to believe 100%.
Absolutely. I could go on about this topic forever. It's one of my favorite topics. I'd love to even do in the future a video like
that's what
specifically.
I know there's a lot you want to cover today.
Yeah, but there are a lot of things that I'd love to chat about as well. Maybe if like from your perspective, could you share a little bit about my case and how having the cervical fusion can affect the potential for curve correction, and like what your approach was in that scenario?
I mean, your case was so amazing because, I was one part of your care plan, and I know you've had, many, many very, talented people involved in your care. But the parts that I recall from, our visit together were, Rachel, where we did still improve your cervical spine curve, which was amazing because, you had C0 to C2 fused. The first time you came in, we mostly just chatted because you were a little bit weary of chiropractors, rightfully so. You didn't want someone to still try to, do some huge adjustment with you. I
was definitely very nervous.
And then I don't know how many visits it took for, you kind of be like, you know what, maybe I'm going to give this doctor a try. Like, let's work on this. But then at some point you even, went, if I can say, you even went against what your surgeon said. Don't ever be adjusted again by a chiropractor. We did super gentle, very specific adjusting, even at your occiput where you're fused. And people might say, well, what do you mean? Well, we probably just released like a fascial restriction. I mean, the thing was on like the lowest power possible. And we did a very gentle adjustment to C0, to the upper neck, the lower neck. And I think that you could open your mouth a little bit better.
Right, with the jaw. Yeah, you were
Yeah,
helping with the jaw as well.
as well.
I wish that it was easier for me to come see you, but
Yeah. And so we were able to, because there was a time when you couldn't take a full bite of like a large piece of food. And, that was able to open better. Your lower
Mhm.
neck curve was way too far forward. This happens so often that people, they have their lower neck curve. It's really far forward.
Mhm.
And so, but they'll get an x-ray and it's like, oh, you've got a lordosis. Yeah, you do. But then if you really did ultrasound of the vessels in front of the neck, you'd see that in the lower neck, they're going to be either like the carotid is pushing way too hard or the jugular is completely closed, because you're actually getting compression between the clavicle and the spine because it's fallen too far forward. So with Rachel, we almost nobody really understands this yet, or even many people don't believe me, or I've been told by people that I've worked for, or people in the community, that this is absolutely a terrible thing to do for somebody. But I've had probably 50 people that I've put a reverse weight on, where it's a weight that brings the spine this way, and they've gotten better blood flow, better drainage out of their head, more clear mentally, better mobility with their neck, from actually getting them out of an excessive lordosis at C7, C6, where it curves too far. And so that's been kind of a unique contribution of something that we've been able to find that really helps with these brain and cervical conditions.
Yeah, I remember when you did the ultrasound. I don't know if you remember this or not, but I remember, according to you guys, it was one of the worst flow you've seen with the jugular. We were doing that, I think, standing, and then you put
Yeah.
the neck weight on, and it totally opened up, and I was like, "Whoa, that's crazy."
And
I think
yeah.
you were even like, "Oh my gosh."
And since then we've learned more. So before, I would only, when I put that reverse weight on, I would only test the blood flow above it. Now I've been exposed to more and learned that I actually check the blood flow above it and below to make sure we're not compressing anything. And
Okay.
then we check how not only that the blood flow is improving above and below the weight we're putting on, the curvature looks better, and that the individual feels better from using it. So we combine all three of those parts before prescribing that. Like, if your lower neck is not too far forward, it's actually a bad therapy for you because it does put pressure in the wrong way. But if you're collapsed here, and
Mhm.
if we get it wide enough, because I designed a new product, one that you actually don't even have yet. But in December, I went to San Diego and I designed with Halo one that hits way further out near the transverse process, so that
Oh,
it doesn't compress the carotid sheath, and it puts barely pressure, but it's a lot better. So
okay, very cool.
yeah,
That's
I can
exciting.
send you one if you want to try it. I don't know if you still need it. We'd have to check you, but yeah.
I'd be curious to see where I'm at now. I have phases where I will use the weight, like if I really feel like it's just, I don't know, I kind of have a sense for it now, but
Yeah, like a
I'll
maintenance, spinal
put it
maintenance.
on, yeah, here
Yeah.
and there, but I don't do it regularly like I did for a lot of last year. But that was just a really interesting thing to me because I kind of wondered, I was like, is it more the curve correction that matters than like the actual prolotherapy? Because that was such a obvious, like, it went from nothing to all the way open. Does that neck posture also affect the vagus nerve?
Yes, definitely. Your vagus nerve doesn't only get irritated in front of C1. It may be one of the most common places that it does, but I mean, it can get pinched anywhere along its pathway throughout your neck. And it's hard to tell exactly where the vagus nerve is getting pinched because the changes in its 2 millimeter diameter happen over periods of months for it to really, change from 2 to 1 to 2. And so we can tell indirectly what's going on with the vagus nerve through the heart rate variability, and also through looking at the structures that are right next to it in the carotid sheath, the carotid artery, the jugular vein, and we can measure those and get some indirect understanding of if there's probably pressure on the
That's,
vagus nerve
that's
too.
so interesting. So that obviously affects nervous system function quite a bit, right?
Yeah, definitely. Yeah, the
Okay.
vagus nerve is really important. Inside of the carotid sheath is the sympathetic chain. It's not as, widespread of functions that it helps regulate as a vagus nerve, but it's still very important. I mean, it connects to and innervates your spinal dura. It sends branches to your heart. It sits right around the carotid artery in the neck. So it's, communicating closely with that. And so, yeah, the neck, I mean, I tell people, I'm like, your neck is so important because it's like right in between your heart and your head, right? And so the blood there has to be the blood and the nerves have to be like perfectly communicating. And when I say perfectly, I don't really mean that. I just mean they have to be relatively uninterrupted. Like that communication network has to stay functioning. If it loses function, it's not good. So
that's really interesting.
yeah.
I'm curious, what has your success been with patients that have severe cervical instability in people that haven't had surgery? So are the majority of your patients people that haven't had surgery?
The majority are patients that have not had surgery. Just today, I just got done before this with a new patient that had a unique surgery where, they removed a like calcified ligament in between C7 and T1, and they shaved off one of his spinous processes. And, he had a couple of unique things done, but most of them have not had surgery. Most of the people that end up starting care with me, people are starting to get better at this, Rachel. I mean, they're starting to intuitively know where they should start. And it's pretty amazing. Like I see the future of the subtle upper cervical cases just getting better and better and dialed in. And pretty soon, people are going to not fall into, well, I've been disabled for 3 years. Once they start going downhill, they're not going to get put through like a year of trial. We'll try this. They're going to know quicker, like get to here. And then if that doesn't work, get to here. And it's going to get scaled much faster because the average person that comes in to see me has probably 5 millimeters of C1 instability or less. And then in their lower neck, they might have a couple spots with 2 or 3, but they're kind of knowing that they're not the one that can not stand even for 10 seconds and they move a little bit and they feel like, they know they're still severe. Like these people, some people are disabled, they can't work, but they're kind of knowing where they should start, I think, which is pretty cool. Yeah.
So I have a lot of good questions from my community for you. Is it possible to come see you without having prolotherapy? And are there ways to make the curve stick without prolotherapy, especially for people with EDS or CCI?
Yeah, that's a great question. It is possible to come see me without getting prolotherapy. I would say that probably 50% of the patients that I've seen in the last year since opening my own practice have not received any prolotherapy or regenerative medicine treatments. And then the other 50% are doing a combination of the kind of work that I do plus regenerative medicine. So it is possible. When you have EDS, as with most illnesses, there's a spectrum of how significant or how much that it actually affects you. So it's just a case-by-case basis. By strengthening the tendons, the more hypermobile you are, the more stability that you need. So the actual standing weights may be a less of a component. They may be like 10 or 20 or 30% of what we think will help you. And then the rest of it will be, we posted a video or a couple of some hypermobile individuals where doing dry needling in the way that I'm learning, which I've taken the MyoPain seminars, functional dry needling coursework probably 6 years ago, but I've been changing it a little to focus exactly on how to stimulate the tendons to get stronger. And we're seeing people getting a lot of amelioration of symptoms that they've had for sometimes 5 years, 10 years.
Wow.
With doing dry needling to tendons, because tendons are collagen, just like ligaments. I mean, they're just barely different in how they're composed. And if you get the tendons to be really strong, I mean, it helps a ton with hypermobility and, EDS type presentations.
That is really cool. Could you just briefly explain what it would look like for somebody that's coming to see you for the first time and what treatment options you have for people with cervical instability?
Sure. So first, if you haven't had a digital motion X-ray, we will perform one of those. If you have had one, but maybe not all of the views that we want, we may do 1 or 2 views to get a better understanding of exactly what's going on in your neck. We review any imaging you have. If you've already had MRIs, CT scans, cone beam, different types of vascular imaging, arterial. And then we do a physical exam. So we find out, where your vulnerabilities are, your weaknesses, go over how your imaging and your physical exam really overlap. We'll conduct ultrasound findings based on your symptoms, whether it's just up and down the entire front of the neck, or if we also add in looking at the vertebral arteries, or even sometimes just below the clavicle if you're getting a lot of one-sided or lower into the chest or different kind of symptoms. So we combine all of those things together between the ultrasound examination, digital motion x-ray, outside scans, physical exam, and then we come up with a plan. So we sit down together and I'll say, okay, your differential diagnosis is here. These are your options. You could either go back home and you could try to find somebody that does X, Y, and Z, or we could do this part of your plan. Or, once in a while, somebody will want us to kind of do as much as we can. So we'll say, well, let's do an intensive plan. Let's see you for 1 week or for 2 weeks, 3 to 5 times a week, and really try to take you from your baseline to feeling 20% better in like a week or two, and see if we can get you to stay there. Then we'll send you home with homework and you can work on that for a period of time before maybe we get you back down here for a few days to, continue to accelerate that progress.
Okay. And is there any programs that you offer that are just virtual, or do you always want to have at least people come in for the initial visit?
Yes, we do. I offer a remote coaching program, which is not a doctor-patient relationship, but it's more like I'm your coach for posture. And that is about approximately a 1-month plan. And we just have a set cost for that. And during that time, if I feel that you would be able to tolerate certain kind of standing weights, which typically are not very heavy, then we would suggest that you obtain certain standing weights. And then we kind of coach you on how to stand when you're using them to get the biggest benefit. And we've had probably 10 people go through that program. And we have seen a few individuals that said, I've definitely had a 50% reduction in my headaches just from fixing my posture, which is pretty cool. So guiding them how to stand and then just having a little bit of forces pulling the neck into a better position. So that's been pretty cool. We also go over your sleeping position. You send images of how you're sleeping. We go over that. We watch them while they're doing different exercises and, find what their vulnerability is. If they're slumping at the low back, we reteach positions there, or if you're hinging too much when you move. So that remote plan is pretty cool. It's about a month's guidance coaching plan for people that really aren't able to get here, but just really want us to still be involved in analyzing their case and helping guide them as a coach.
That's awesome. I know a lot of people that have asked questions for you are international, so that may be something good to consider for people that aren't right now able to come see you in person. Let's see, what else do we have here? I had another person ask, is it possible to fix cervical instability without surgery?
Well, of course. And when it comes to fix, what is your goal? So, Rachel, I just brutally honest, I've seen people that were unstable from like a DMX and got full stability. Like, they tilted and there was no motion at C1, C2, but they still had all the symptoms that they came in for. And then I've seen people that have 6 millimeters of instability and got it down to 5 millimeters and they feel like they're 80% better. So, when you say, is it possible to fix cervical instability without surgery? I mean, is your goal to fix cervical instability related symptoms? Then 1000% yes. 1000% yes. And when you consider, like, am I somebody that needs surgery? It's just, there are people that need the surgery, but you just have to really see, have I done everything that I can first? And sometimes just doing, 4 to 6 weeks of physical therapy at the place that the surgeon had recommended you go to isn't enough to just rule out the fact that, can I get better before surgery? Now, if your symptoms are so dangerous that the doctors think you're not going to survive if you don't get it, then you better go and get the surgery. There's a point when surgery is going to save your life. And I just want to make that clear. It's really important to know that. But if you're just feeling like, gosh, I just can't continue living like this because I know every time I go to the ER, they say I'm fine, I'm stable, but I feel so weird and I'm out of body and my neck clicks and I'm just feel I have this crazy head pressure. I mean, I would really try, make sure you optimize your curve. Your tendons are all super strong so you can move correctly. And then you get treatments if that's not enough, then to the deeper components of spinal stability, like some of the ligaments and capsular ligaments, or even other ones that are deeper, closer to the spinal cord. But start on the outside. When things like this happen, it's usually that you start off with a pretty bad posture and the tendons are exposed to too much force. And when they get weak, then the ligaments get the excessive force. So pull it back, go backward, get the curve better, correct the tendons, make sure you can hold your head in a perfect position easily. And if you've really exhausted all the potential options there, then I would consider surgery. And the reason that I'm so kind of like competitive with my videos, like, hey, we need to do something now, is because with these conditions, if you just sit and wait and you don't do anything, often they are progressive. They will get worse. So I don't want people to wait 1 year, 2 years, 3 years, and only trying one kind of regular PT or just doing a little adjustment or doing something like that. And then they get into a condition where they do need the surgery. So I think we could stop some of those.
It's interesting that you say that, because that was my situation when I was told to try physical therapy for 6 weeks and it didn't do anything to help me. But if I had known about some of these other things that I've implemented after I had surgery, I definitely would not have had the surgery before doing all of those things. And I believe that I could have recovered even better than I have if I had not had the surgery. And I think it's important to be transparent about that as well, because it's not like the surgery is a guarantee. And I think there are always drawbacks to it too, because it's changing your range of motion, it's changing your ability to move. That's a very sensitive area of the neck. Like, there are risks to having surgery, and there's no guarantee either. And I really just appreciate what you're doing, because it's something that I think most doctors just aren't aware of and they're not capable of doing yet. I hope that will change in the future. But it's interesting to me, because the best outcomes I've seen from people with cervical instability have not been people that have gotten surgery. There's always the outlier. There's always that one person that maybe had an amazing outcome, but from the many people that I've come in contact with that have had surgery, the outcome hasn't been so great.
The good surgeons also will try not to operate on you, like the ones that people have lines for months and months to go to that do upper cervical fusions. I mean, they really try to not operate on you. They'll be like, well, I think you should try more rehab first. And so the good ones actually know, because sometimes it is the miracle surgery and it totally changes their life. But surgeons have a hard job, because if they can't just get base hits, like, if you come to see me and you're 25% better by the end of the month, you're pretty happy with what I've done, right? And sometimes you might be 75, but if a surgeon doesn't completely fix you, then people are unhappy. So they have a really hard job too.
What was interesting in my case was that I brought up regenerative medicine, and they told me that was more risky than having the surgery, which I don't agree with. And
yeah, I mean, that's
I know this is a sensitive topic, so
no, it's not. If you look at it from least invasive and least side effects to most invasive and most side effects, I mean, it would be try upper cervical chiropractic, probably the most gentle thing you can possibly do, as long as it's not like the knee to chest one, which is a little more aggressive. But they use a little instrument, barely click one bone. That might fix your headache. You might be better. And then if that doesn't work, escalate, like try physical therapy, maybe rehab, try curve correction. Then if you're stuck there, you have to get a little bit invasive. Try dry needling to tendons and superficial ligaments. Very easy to do if you know what you're doing, and it gets amazing results. Then you escalate and you could get deeper injections with prolotherapy, PRP, bone marrow, different stem cells. And then from there, you're looking at surgery. But if it's not like a life or death thing, I mean, I would try to walk that path.
yeah.
And, if you're able to, if you have the means to do that.
Right.
Yeah.
Speaking of having the means to do that, this is like one of the most common questions I got for you was, what would you recommend to do at home if you don't have the means to come see you or to come see someone to have prolotherapy treatments? are there things that they can do at home to help improve the neck curve?
Yeah, there's no one size fits all, but I'm going to try to give a, fast food restaurant, there's 3 items on the menu, one size fits all for this. And the main thing that I see, Rachel, with people with any kind of upper neck injuries is, first of all, you have to be able to get out of the hinge position.
Okay.
That's the number one worst thing that I've gotten mine well enough that I can't actually hinge like I used to. I used to be able to take my lower neck and like protrude it forward. It almost all moves together now, but it was like at C6, C7, there was just a break where that spot would go forward and my head would go up and my suboccipital muscles were so weak. And so I say, like, when you move around, you have to keep your neck up into this position. And like, if you get up, you have to get up while you're still here instead of, getting up like this. So many people get up like this, or they're told by their doctors to just pull their arms back and look up, and it like kinks them more into this position. And so that actually is exacerbating because you're contracting, closing off like the suboccipital muscles, which the suboccipital muscles are supposed to keep the head from falling backward on C1. So when they're not working is when you're here and the head falls backward on C1. So that's one of the most pathologic motions that anybody with upper cervical instability does. And some people get really lucky. You'll see certain people, they have this terrible kind of like kinking like this, right? They have this, they're like right here, and it's just such a terrible position, but their bodies have built like a little bone spur off of the skull, and their C1 posterior arch is angled up. So in a lot of those individuals, there's like a little spur coming off of the skull here, and this arch is aimed up so that even when they're in that terrible position, they're first hitting this extra bone that they've built before they're hitting the C1 occipital nerve root, before they're compressing so much of the suboccipital muscles that they're getting dural headaches and dural pulling and feeling brain zaps. So the most important thing you can do is all the muscles that connect to these bones, you want to keep them up like this. The very top, like C0 to C1, you don't have to try to keep tilting your head up, like tilting the head up. It's more your lower neck should be in and tall, and then like in your middle of your neck should have a gentle up. But, just doing this position is probably the worst thing that anybody can tell you if you have upper cervical instability, in my opinion. It also pushes C1 forward, and then it's going to irritate everything in here. So you got to keep it more in this position when you're moving.
Okay.
And if you're resting, like taking breaks, you should try to keep it like where your head is more here instead of letting it go like this.
Oh, yeah.
Does that make sense? Yeah.
Yeah.
Instead, like try to drive your back into the back of it and keep this like straighter here.
Okay.
Instead of being like that, right? Then that's going to kink it. Okay. Sorry. I went off on a tangent.
No, that's good. Helpful.
But otherwise, I'll try to teach people, and I can maybe share with you videos, like things you can do at home. I'll try to get like a bigger list. But the biggest thing is get out of that hinging position. That's really going to help a lot to give the chance for the suboccipitals to start to strengthen.
As for if somebody is looking for a chiropractor to see, I know a lot of people with cervical instability are very hesitant to see a chiropractor. Is there something people should look out for when searching for an upper cervical chiropractor? Things that should be a red flag or things that should be a good sign?
I just had a chat this morning with another one of my friends. It's an upper cervical chiropractor who's like really innovative. He uses cone beam CT scan, and he's always trying to like think outside the box. And him and I were talking about being open-minded to a lot of times in these cases, the lower neck is not moving correctly. It's stiff and it's tight, and the upper neck is moving too much. So there's a lot of people that I don't even adjust their C1 because it's already moving too much. So I might adjust like C7 backward, or maybe there's a rib or something, but mostly we're working on improving the curve with weights, and then maybe dry needling super hypermobile spots so that we can strengthen those tendons and get them into the right place. Finding a good upper cervical chiropractor is going to be one that has a good reputation in the community. Look for favorable reviews, somebody that one of your friends goes to, somebody you know from a community group that has referred you, you got to find somebody that can look at you eye to eye. And most of them will. I mean, most chiropractors are in it because they love helping people heal. But I would say if you start to introduce to somebody that, hey, I want to work on improving my curve, and I have upper cervical instability, and I maybe will be getting a little bit of regenerative medicine. And if they try to tell you, oh no, you absolutely should never do any of that, that might be a yellow flag, at least. Like maybe they're not going to be the best one, but find somebody that understands that sometimes you do need to put forces on the spine to improve the curve, that sometimes you may need injections to help strengthen ligaments. And then I think you're kind of in the right place right there. So
Okay. And do other chiropractors do a similar curve correction approach? Is that a common thing for chiropractors to do, or is it still kind of uncommon?
the beginnings of what I learned with curve correction were from Dr. Dennis Wogan, who founded the Clear Scoliosis program. And then I kind of took it and I've just been custom tailoring it to what I see in practice. And then another group of doctors that works on corrective is what they call it, which has to do with improving curvature and alignment, is chiropractic biophysics. Dr. Wogan really led me on to the fact that you need to be super specific and gentle with your adjustments with these patients. So that's why I took classes in upper cervical chiropractic, and I have the instruments where we barely move one bone, just barely. And sometimes that's all you need to do. It's really powerful. And then also using specific weighting. We designed 2 new products with the Halo Weight Company. I went out in December and we made progress with, I think I was the first one to put the reverse weight on, which we used with you, Rachel. And you said that part of it was helpful for you. We saw your lower neck curve went from being super far forward to being up taller. So that helped displace the weight of your head on your body better. But I think I've made just probably like a 2 or a 3%. Hopefully people will think over time improvement in what was already out there, and then just combined a lot of the best therapies to get kind of my approach.
Well, I think that mostly sums it up for the questions that I have. I know there are so many topics that we could probably talk for hours about, so we'll have to do another video sometime. But I really appreciate you coming on. Is there anything that you would like to share with people who might be in a really difficult place right now dealing with cervical instability? What advice or encouragement would you have for somebody in that situation?
Yeah, if you're just in a terrible place dealing with neurologic symptoms from cervical instability, I would say that you have to try to do something each day. And, like Rachel and I talked about earlier in the video, was just find that courage somewhere within you to try again. Like, there was this interesting thing I saw online earlier today that was actually inspiring. Sometimes we see things online and we're like, oh, really? But what the gentleman said was, okay, if I gave you $1 million today, would you be happy? Like, would pretty much, for a few days, like you'd be pretty happy, right? He's like, okay. Now, and if I give you $10 million, you'd be pretty happy too. He goes, what if I gave you that $10 million, but you couldn't wake up tomorrow? Like tomorrow, that was it. And then they said, no way, I wouldn't take it. And so then he said, so waking up tomorrow, you're telling me, is more important than $10 million. And they were all like, wow, now that you said it that way, it's like, so every day you should be feeling like this is a good day. And it can be really hard to do that when you know where you were at one point, or what is expected of you from people around you, or what you feel like societal norms are for how you should be performing on a day-to-day. But like just being alive, there still is a gift in that. And please focus on, what can I do? Even if it's just 30 seconds today. I tried to fire my suboccipital muscles. I was conscious that when I went to the bathroom that I didn't hinge here, and I started to hold this position that Dr. Hutcheson showed me on this video. Or, I did a little tiny bit of research and I focused on the people that are healing, like Rachel alluded to earlier, and only spend 10% effort or energy on the people that are still sick, because I still want to be connected to that, but I want to focus more on where I'm going. So, just never give up, and, just keep trying to take the leap forward. And with enough consistency, you'll get there.
That's awesome. Thanks so much, Dr. Brian. Well, I will link your YouTube channel and website down below. Is there any other way that people should find you?
Yeah, that's perfect. The YouTube channel and the website. Thank you so much, Rachel.
Awesome. Thanks so much, Dr. Brian.
All right, you take care.